It's World Breastfeeding Week, and the American Academy of Pediatrics recently issued new breastfeeding recommendations.
They now say it is best to nurse your child until they are 2 years old or beyond.
I'm very excited about the American Academy of Pediatrics supporting and recommending breastfeeding up to 2 years. They recommended exclusive breastfeeding for the first 6 months of life, and then after that, with complementary foods, breastfeeding up to 2 years. Exclusive breastfeeding for the first 6 months means that your infant only receives breast milk, either directly at the breast or in a bottle. So that means no water is necessary, no juice is necessary, and yes, not even formula is necessary in the first 6 months. Breast milk never loses value for the child's immune system.
Research has shown links between breastfeeding and decreased rates of lower respiratory tract infections, obesity, severe diarrhea, ear infections, and decreased risk of sudden infant death syndrome. Breastfeeding beyond 1 year and for up to 2 years has been associated with protections for the mother against high blood pressure, diabetes, and breast and ovary cancers. But the authors of the new guidance also acknowledge that some parents can't breastfeed or prefer not to.
Sometimes real medical reasons, we have to step in and help the baby to get supplements, as like in the case of formula, to help them. So we're not saying we're against breastfeeding, but we have to also look at the best interest of the baby.
It's nice to have that to back me up.
More than a third of moms are afraid to tell their pediatrician they're still breastfeeding beyond a year, says Dr. Suzanne Brixey.
The evidence is showing there had been some public shaming for families who wanted to continue breastfeeding beyond a year, and we're here to support families.
Brixey says that's one reason the AAP updated its recommendation. That and the increased health benefits for baby and mom.
When we have an opportunity to decrease maternal diabetes, decrease hypertension, decrease breast cancer, ovarian cancer, we want to support those efforts for our families.
But families may still struggle with policies that fall short of that support.
There are legal ramifications that support you for your pumping journey when you go back to work.
Lactation consultant Jessica Williams is talking about break time laws that allow working moms time to pump. Family leave laws also provide time to care for newborns, but they're not always paid. Augusta says if we really want to support families, that needs to change.
I think that is something that we are still lagging on in this country.